I am really honoured and grateful and excited to be in the same Zoom room with so many people who've been thinking and working so long and so innovatively and from so many different angles about this fundamental issue of human and planetary health and how they're linked, specifically here through breastfeeding. I think it demonstrates that whatever sector we come from, whatever angle we come from, we all have a part to play. And I'm going to talk briefly about one way that we can play our part. So we know that there are breastfeeding interventions that have proved effective and feasible in increasing exclusive breastfeeding and decreasing the use of commercial milk formula. So some of these are, for example, adopting and enforcing the International Code of Marketing of Breast Milk Substitutes, the WHO code, enacting paid maternity leave and workplace breastfeeding policies, promoting the baby-friendly hospital initiative, or 10 steps, and providing more and better breastfeeding counselling and information to mothers. So let's take a look at one of those, namely maternity leave, which Julie mentioned a couple of times. And we're really lucky to have an example of maternity leave in Canada. So in 2008, Canada increased paid maternity leave from 25 weeks to 50 weeks. And the result was an increase in exclusive breastfeeding of somewhere between 7.7 to 9.1 percentage points, which is a 40% increase, in fact. So if we take this example, we can make a really simple calculation. So we know how many infants were born in 2008. We know that before 2008, around 23% of babies were exclusively breastfed until 6 months. I'm sorry, I should say that was exclusive breastfeeding rate to 6 months. And we know that after the increase in paid maternity leave, that figure increased to 31, almost 32%. So if we do the math, we can see the number of children in either before and after who are being exclusively breastfed. We can see, and we simplified, for sure, we've made some simplifications because we only have exclusive breastfeeding rate there. I've gone ahead and assumed that the other children were exclusively formula fed. It's simplistic, but it's a place to start. So using that and knowing that every child that is exclusively formula fed from 0 to 6 months requires 21 kilos of commercial milk formula, and knowing that each kilo of commercial milk formula is responsible for somewhere between 11 and 14 kilograms of carbon dioxide. I've chosen to use the 14 kilos, so I'm giving the high end of the scale. So using those numbers and that data that we have, our simple calculation can show or suggest that paid maternity leave policy that was implemented in 2008 in Canada reduced Canada's greenhouse gas emissions by over 9 million kilogram equivalent of carbon dioxide, simply by increasing exclusive breastfeeding. So for me, this is a really powerful example of how we can use the tool to see what difference we can make by increasing exclusive breastfeeding, not only to mothers and babies' health, but also to planetary health. And I would encourage you to use the tool in this way, to imagine for yourself, if in our country or in our setting, we increased paid maternity leave, or we adopted the WHO code, or we provided more and better counselling to mothers, and see what difference could we make to mothers and babies' health, but also to planetary health by reducing greenhouse gas emissions. So have fun playing with the tool. I certainly have. Thanks very much.
I'll be speaking very briefly about Indonesia as a background. So for you who those haven't understand where Indonesia is, we are located in Southeast Asia. We have a vast area and in archipelago, so we're separated in different islands. We have a huge population, so it was a big punchy target for commercial marketing. Some of you might know it. We have marketing involving medical staff and also using mom influencer as well. And then this massive marketing undermine mother's ability, and it's, I know, unethical. So with these green feeding tools, it will be very great to give a protection. So we have already laws that protect and support breastfeeding, but in reality, we have not so strong law enforcement. So with green feeding tool, I've tried it. Thank you. I really wish that it could give multiple approach. So from individual like mothers and their families, for the mother, we could say, I don't know if you can say now, but at least if you want to make your breastfeeding session longer month, then you already contribute to lowering the greenhouse gases. And also, I wish that while the individual approach is being carried on, it also being advocate to the government. So I guess in Indonesia, like has been told earlier, we also want to reduce the emission. So if this could be a way to advocate government to protect and increase breastfeeding rate, I would be gladly to inform more people to do this. Last but not least, I really, really want these tools to work. So maybe in the future, it could be more user friendly. Now we have to open Excel files, and I don't think mothers in here would be able to open it anytime, anywhere. So when it included in application, when you click one thing and then the result comes out, it will be more interesting.
So, hi everyone. Thank you for the opportunity to share my experience in using this important tool. And when I asked to share my experiences using this tool, I think I would connect this to my PhD research, which focuses on baby-friendly hospital initiative in Australia and Indonesia. As we all know, the first few days after birth is very critical for breastfeeding journey. Therefore, WHO launched the 10 steps to successful breastfeeding in 1989 and amended it to BFHI 1991 to ensure mothers have adequate information and support to initiate breastfeeding and maintain it even after discharge. There are lots of evidence that BFHI is associated with higher likelihood of breastfeeding initiation and duration. Unfortunately, the global uptake of BFHI is very low. Only 10% babies were born in a baby-friendly hospital. In Australia, only 26% of hospital is accredited baby-friendly, while in Indonesia, only 8% of government hospitals was implementing the 10 steps. So I tried to make a simulation for two countries that I also used for my PhD research. The first one is Australia. As the baseline data is not available for this country, as mentioned by Alex previously, so I used the data that is available from Australian National Infant Feeding Survey into 2010 as baseline data. And then I also put the counterfactual data in the scenario where there is no 10 steps or BFHI, then the breastfeeding rate decreases and extinct. We can see the results here that the carbon and water footprints are high. And I also play around with my second country using Indonesia, and the baseline data is available. So I just input the counterfactual data in the scenario the same as previously, where there is no 10 steps or BFHI, then the breastfeeding rate decreases and extinct. So you can see that in the diagram there. These two scenarios are really terrible. So therefore, I would emphasize the importance of investing in breastfeeding supports, especially in the first few days after birth. I also want to draw your attention to my social value calculation. These two case studies have been published in an open access journals. Every $1 invested in maintaining BFHI accreditation in one hospital in Australia brings 55 Australian dollar or 37 US dollar of benefit, while every $1 invested in implementing the 10 steps in one hospital in Indonesia brings 49 US dollar of benefit. So in conclusion, this green feeding tool, we can show policymakers that breastfeeding is also beneficial, not only for mothers and babies' health, but also for the economy and the environment. Thank you.
Distinguished and all participants, good morning and good evening. Thank you for inviting me to present on the use of green feeding tool for nutrition prosthetic and carbon offset. This is a very new area for Nepal. As we see in Nepal, the exclusive breastfeeding rate among children aged 0 to 5 months has been declined from 66% in 2016 to 57% in 2022, as per the Nepal Demographic Health Survey. That means bottle feeding has been more than double, with an increase from 12 to 30% between 2016 and 2022. So because of this increasing breastfeeding, bottle feeding, these results indicate there is a potential increase in carbon emission due to the increased use of formula milk and dairy milk. And Nepal has experienced a lot of urbanization, migration, and with these urbanized migrations, the infant foods are reaching in the supermarket and the local markets. So in this regard, green feeding tool has a potential use for breastfeeding advocacy in Nepal. However, this tool alone may not be convinced to advocate for improved investment in breastfeeding policies and programs in Nepal. That means we need to combine with other tools like mother's milk tool and cost of not breastfeeding tool with the development of a comprehensive advocacy brief, which can, if we'll develop, that is spark to multiple audiences within the government. That means the Ministry of Environment need also be advocated, or the Ministry of Agriculture and Livestock also need to be advocated beyond the health. The reason is, after attending to this webinar, I also realized there is very less awareness in infant formula is also in ultra processed food, and it has a health as well as environmental impact. So after this webinar, surely we have been able to advocate more about exclusive breastfeeding and also help government to understand these mothers, this tools benefit for the mother's health as well as the planetary health.
I'm going to start with a lens on the issues we face in Aotearoa and end with some green feeding optimism. So a 2023 report by Changing Markets, which has already been introduced by Alma earlier, found that Fonterra, who are a global dairy cooperative based in New Zealand, who export about 95% of their product, well, they were one of 14 meat and dairy companies actively greenwashing their products. So general industry tactics involve inaction disguised as action, tricks and misdirections, and what I call dairy fairy stories, which I put at the bottom. So what I mean by that is we get lots of promotional media releases about ingredients that are going to be put into formula which will replace breast milk or reproduce breast milk, which of course can never be. Troy Basin, who is a professor of lake and freshwater sciences at the University of Otago, wrote in 2020 about the bleak news regarding freshwater ecosystems in New Zealand. So 95 to 99% of rivers running through urban and farming areas carry pollution above the water quality guidelines. Dr. Mike Joy, who's an ecologist and senior researcher at Victoria University in Wellington, quantified the footprint of milk production in Canterbury, which is where I live. It's a region in the South Island with a lot of cows. Basically, as it says there are too many cows and too much fertilizer. I just wanted to put this slide in because I recommend, if anyone can manage to watch it, the link is on there. It draws attention to the flaws in industrial agriculture, but it also exposes the sustainability crisis. So it's well worth watching if you can get hold of it wherever you are in the world. So there are a number of unsustainable footprints that need to be mitigated to reduce climate damage and reduce health risks in New Zealand. We have nitrate problems, we have E. coli issues. We had really good water, particularly in Canterbury, we had excellent water, and now we have to have chlorinated water because of E. coli. We have an unsustainable dairy industry, and as Mike Joy has pointed out in the previous conversation article I put up there, to continue dairy production and have healthy water in Canterbury, we would need either 12 times more rainfall or a 12-fold reduction in cows. I added this slide from a First Steps Nutrition, a recent First Steps Nutrition report, because I think it highlights the issues related to a lack of protection and support of breastfeeding. And it also illustrates how babies and children can be undervalued in our current system. And of course, it also draws attention to the inappropriate marketing by the baby food industry, who misleads families into purchasing things that they don't really need to purchase. And now we have the cost of living crisis in many places. It's really having negative impacts and worrying implications for infants and young children. There's an inequity inherent in infant feeding decisions that needs addressing, because we don't value women, babies, or breastfeeding, and the barriers to breastfeeding are often out of maternal control, as has been highlighted numerous times by Professor Amy Brown. So media stories can and do deflect attention. So they deflect attention from industry and blame individuals when it comes to climate change. And also there's a blame that can be put onto women for not breastfeeding. So that media framing can mask the barriers that we know exist. So we blame the women rather than the systems. This is actually from an interesting recent publication from the Australian and New Zealand Formula Marketers Association, also known as the Infant Nutrition Council. I think what it really illustrates to me is not only the high use of commercial milk formula, but also the success of marketing strategies. This was a survey. 974 parents were in the survey, and there was another 70 parents who were involved in online discussions or focus groups. 40% of these parents used toddler milk, and 56% of the parents believed that this was good nutrition. So I think it shows quite clearly that marketing is definitely working. So now for mitigation and adaptation and resilience, I guess. So transformation, which is what we're looking at, changing everything about how we live. It requires a whole new way of thinking. It requires degrowth, using less. It requires a reduction in damaging production and reducing dairy. In New Zealand in 1990, we had 3.5 million cows, and now we have 6.3 million, which is quite a lot. And the majority of those are probably grazing in areas where they shouldn't be grazing, hence the problem we have in Canterbury with all our rivers and our water, our fresh water. So the focus needs to change to human and planetary well-being, as we know. And for me, I see hope in quite a few things, which is quite good. We're about to re-establish a National Breastfeeding Committee, or a National Breastfeeding Infant Young Child Feeding Committee in New Zealand after a number of years of not having one. And this committee will hopefully hold the line about the importance of exclusive breastfeeding and also the duration of breastfeeding. And also they will look at the collection of robust data, because we haven't really got what I would consider to be robust data collection in New Zealand. We have good data from BFHI in our maternity facilities. And then after that, the latest data that I can get hold of only goes now up until 3 months. So I couldn't tell you how many women are still breastfeeding at 1 year in New Zealand at the moment. Also, of course, it's about the international code, and it's about BFHI. We're very fortunate in New Zealand because it's part of the maternity services contract to actually be a BFHI accredited maternity facility. So all of our maternity facilities are BFHI accredited. I think the other thing that the National Breastfeeding Infant Young Child Feeding Committee will be able to do now is not only introduce the World Breastfeeding Trends Initiative, but also another big reason for hope is that they will be able to introduce the Mother's Milk Tool, and also use the green feeding tool, which is what we're here to celebrate today. So this tool will really help us to engage environmentalists and policymakers and governments to act on the increasing threats that we face in New Zealand. Misinformation and marketing needs to be addressed. And of course, the challenge here is to draw attention to more attention, because there's already attention on dairy, but more attention to dairy farming and water pollution. I think the issue is there that drawing the attention to that to infant feeding. So I hope that the green feeding tool will now draw attention to the environmental importance of protecting and supporting breastfeeding and also climate action from birth. Thank you.